healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Welcome everyone, and thank you for joining us. Today's session is CMS-0057 and Prior Authorization Readiness. Couldn't be more timely. I think everybody who has anything to do with prior auth is probably paying attention to this subject. We're no different, as Infinix is obviously a prior authorization provider. So yes, we're head down into it. And so why not bring the expert on this? And it's doing the heavy lifting on our end for everything is Aarti Sivarja. So she's the Senior Director of Product at Infinix. So Aarti, just want to welcome you aboard. Why don't you just tell us a bit about yourself?
Yeah, thank you, Stuart. Hi, my name is Aarti Sivaraj. I lead the interoperability initiatives at Infinix, and I'm a part of the product team for patient access here. Been with Infinix for a little less than 2 years now, and as Stuart said, a big part of my role is working on interoperability initiatives, right? So I work with providers, EHRs, payer partners to understand how prior authorization workflows are evolving. So this discussion is very timely, and I'm looking forward to it.
Yeah, so happy to have you on here. And I can tell you, anyone from product, it's hard to get on office hours because they don't have time, right? You're too busy solving problems, too busy solving problems. But I'm so happy to have you here. It's very gracious for you to be here. And as you said, today we're going to discuss how CMS-0057, or I like to call it the Heinz 57 of prior auth, so to speak, and HTI-4, how that aspect too, we're going to learn a little bit more about that, will change prior authorization workflows. What providers should be asking vendors. That's a very important part of it. And how organizations can prepare over the next 6, 12, or even 18 months. We know that January 1 is the quote unquote deadline, but we know that's just the beginning. So with that, Aarti, you ready to dive right in?
Let's do it.
All right. So let's start with kind of a big picture, kind of going high level. Why should providers think about CMS-57 and HTI-4 together rather than treating just the CMS-57 as a standalone payer rule?
Yep, that's a great question to begin with. I think let's start unpacking these, right? So it's actually really difficult to talk about one without the other. CMS-57, which is a rule passed by CMS, and HTI-4, which is a rule passed by ONC, are really government's attempt to move our healthcare industry towards a very standardized, a connected approach towards prior authorization. So the objective is really simple, right? So it's not just introducing a new technology or a new API, but what they're really hoping to do is by enabling real-time data exchange and a more standardized response, the goal is really for faster decisions, fewer back and forths that we today have, and more importantly, I think a lot of transparency into the outcomes of the prior auth decision. So in simple terms, the way to differentiate these two terminology is CMS-57 tells payers, here's when and how you need to take in the prior auth request, and here's how you need to communicate back the decision. HTI-4, on the other hand, it tells the certified EHR vendors, here's when and how payers are expecting to receive your request, the prior auth request, and here's how they would respond to it, right? So if really only one side changes, you're not improving the entire ecosystem or the experience. So payers can expose all the APIs they want, but if providers can't really access that information or access that workflow, then the operational burden still exists. It doesn't really change. So, I really like to think of it as two halves of the same story or two sides of the same ecosystem. One is really enabling the supply of information. The other one is really enabling the use of it, right? So it's, in all, it's the opportunity for prior auth to become more connected than it is today.
Yeah, and we know it needs that. It needs to be more connected because I can tell you that's still the number one issue is prior authorization. It's tops in denials. It's tops in all the discussions that I'm having, even with clients. It's just such a still heavy burden. And I think everyone has some hopes that this is going to be, some relief towards that. Now, there is a lot of conversation, however, is more about these rules that get very technical, very quickly. because obviously it is all about integration, maybe even some interoperability comes into play here. But from a provider operations perspective, what is the bigger end-to-end workflow change that people should understand the most?
Yeah, this is one of my favorite questions, right? Like, okay, we understand the rules, we read the regulations. What does it really mean to me, right? Again, it's helpful to stop thinking about this as a technology project or as an interoperability project, right? So let's just look at it from a perspective of somebody that's working a prior auth today. What are they doing today? Let's say it's an MRI of a knee that the provider has ordered. The prior auth specialist now will look into multiple payer portals. They'll try to determine if an auth is required or not to begin with. And then they're going to start gathering documentation, assuming an auth is required. They'll submit it through another payer portal, and then they'll start following up or checking on the status of the auth until the determination or an outcome has been provided by the payer, right? So the vision or the goal behind CMS 57 is really to make all of this information exchange very standardized and electronic. So over time, what does this mean for providers is really that they're spending less time navigating all of these different payer processes, documentation, et cetera. And they're really using that time in an effective way on the existing clinical workflows and operational workflows where their input is much, much needed, right? It's not in figuring out which document or which portal to go to or where to do the follow-up. It's really in the clinical questions so that they can assist their patients in a timely manner. I'll also add that it's important to recognize that this doesn't mean that prior authorization suddenly becomes, automatic or the problem disappears, right? So payer decisions will still be based on their policies and medical necessity. And it just means that the information moves between the providers and the payers has the potential to become more efficient. And I think, overall, that's really how I'd encourage the providers to think about it, is that it's not just a technology initiative, it's really an operational improvement that there is a huge opportunity for in this.
Yeah, and it seems to me like I said earlier, this is a huge, huge issue, with providers, and it's almost like this hope, but can they trust that hope? Is it really all going to come together? Because as you pointed out, it's regulations, but it's also more than a regulation. The idea is to improve workflow. I think the intent is there, but I think people are still going to be very skeptical. I'll believe it when I see it, right? And because there's so many factors, payers have to cooperate, providers obviously have to get involved. The vendors, like us, we're making the adjustments according to the regulations. But I think there's still a lot of things that's going to be foreseen as this unfolds even more. But where could these regulations have the biggest impact on today's prior authorization pain points?
Yeah, I think just being in the healthcare industry for a while now, from my experience, I feel like the biggest frustration in a provider's workflow, especially around prior authorization, is around the several uncertainties, right? So there's uncertainty that if is it not needed or not, or which payer policies apply, which documents are really needed for this prior authorization, or why is my request pending, right? Why hasn't the payer responded? Why is it taking so much time? There's just so much uncertainties packed into this prior authorization process. And I feel like this particular regulations that we're talking about, it has a direct impact on all of these. The biggest win, in my opinion, is again, providers, they will spend less time chasing information, right? And they're going to have more time focusing on their patients because, our famous no authorization required, right? Imagine a specialist spends 20 minutes preparing all the documentation, getting all the information ready to submit to the payer. And then they find out that the service or the order that the provider put in really never needed a prior auth in the first place, right? It's just frustrating. I think the CMS-57 and HTI-4, they provide opportunities in the clinical workflow at the right steps to make sure that information can be surfaced earlier so that upfront somebody knows that, a service really doesn't need to go through an auth process. So now you've eliminated all that downstream burden associated with it, right? So I think that's where providers have the biggest value. Again, like it's more in the operational workflow and the clinical workflow because things like coverage determination, right? What we're calling a CRD, this will help surface the determination results much earlier in the clinical workflow rather than waiting for the prior auth to go reach the payer and then come back with an actual response saying, hey, no auth was required.
Oh, awesome, awesome. And I like the no auth required example because, yeah, you get to that stage, you're like, wait a minute, I didn't even need an authorization. But on the flip side, you get a no auth required, and all of a sudden you still get a denial.
Yeah.
So it's almost that this should help with that, because right now everyone's taking screenshots, because they know from experience. Well, if I don't take this screenshot, I need to prove that it said no auth required when I actually determined this when it came up for denial. It's almost like this expectation for the denial in that respect. But for vendors, many times, and you and I talked about this during our prep, is regulations come out and the vendors are on the hook to try and make it work from a technical standpoint, right? It's one thing to write the regulation, but and also to give the specs, but then you have to do it. And there's so many proprietary systems out there and so many vendors hustling to get this done. So I would imagine January 1, many vendors will say they're CMS 57 compliant, but what should providers ask to understand whether that compliance actually supports the full prior authorization workflow?
Definitely think it's a great question too. Yeah, I mean, and looking at all the forums where they talk about CMS-57 and HTI-4, you'll see there's a variety of, partners in general, be it providers, payers, or these new technology vendors that are coming up, to use this opportunity to provide some, background and infrastructure around the compliant APIs. I think providers, the first thing you should stop asking is, are you CMS-57 compliant, right? That's just a yes or no question. It doesn't tell you much about how their organization is preparing for the transition. Instead, what I would encourage providers to ask is three broad questions. One is, hey, vendor, what's your CMS-57 roadmap looking like, right? Whether you're talking to an EHR vendor or a prior auth vendor or a clearinghouse vendor or really any other technology partner, ask them what capabilities they're planning to support, when are they going to be available, and how those timelines may or may not align with your organization's plans for CMS-57 and HTI-4 support. The second question is, how will this really work with my existing workflow, right? Because technology shouldn't be forcing provider organizations to redesign their operations overnight, right? So ask your vendors how those new capabilities, the new way of exchanging information, is going to fit into your current prior auth process, right? My staff will want to continue working in their familiar workflows until we know certainly that what exactly is going to be changing, right? So ask them about how they'll support during the transition and what changes will be expected and how they'll be trained, how the staff will be trained to use those new workflows. And then the most important last question is, again, how are you going to support us during the transition, right? Because I think people in the industry know this, but different participants are going to be going at different paces, right? Some payers are going to be ready sooner than the others. Some EHRs are going to be leaders and they'll adopt these capabilities much earlier than some of the others. So ask your vendor, how are you going to help me operate in this hybrid environment? And how are you going to help me use both my existing workflows and these new interoperability standards where they're available? I think at the end of the day, it's not just the compliance that providers are interested in. They want to buy solutions that really helps their team work efficiently and causes less burden, because that's the goal of it, right? We don't want the providers to be overburdened by this, but rather it's the opposite of this.
Yeah, that's so wise the way you laid that out, because you're right. You don't want a closed-ended question. That's excellent advice that I think everyone should really put in their roadmap or in their assessments when they're looking at, even if it's an existing vendor, they really need to start asking those questions now, right?
Yeah.
So it's not you don't ask January 1, you start asking those questions now for sure.
I think we're starting to see that transitions toward, I mean, as recently as this week, we have some prospects and customers that are asking us these questions now. So providers are starting to understand that this means something to them and they're asking the right questions. So that's really a good sign, right? So it's never too late. So start understanding what these mean to you and ask these questions to your partners that you're working with.
No, that's perfect. Perfect. So do you expect the transition to be clean and standardized, or should providers prepare for, say, a payer by payer variation in some kind of hybrid workflow going forward? It's like, or is it flip the switch and everything's on, right?
I chuckle because I think none of the regulations within healthcare is a flip switch and it's a
Right.
clean decision, right? I think the short answer is that the industry itself is moving towards standardization, but the transition is not going to be standardized or it's not going to be clean and smooth, right? What CMS-57 establishes is this common framework for how the information should be exchanged. And that's very important because today, each payer, they have their own processes, right? Like there's APIs, there's portals, there's even phone, fax, all of these different ways you can exchange information. But these regulations are not going to change all of that instantly in a flip switch. Like I said earlier, payers are going to adopt this at different times. And the same goes with EHR vendors as well. Some will be early adopters who have modern technology. Some are going to take some time to make the changes, right? So I think it's important to understand that there will be some differences, especially on the payer sides. Even though the standards exist, there are going to be some differences in what we've seen. So organizations that will be most successful, I think, are the ones that are preparing for the flexibility rather than expecting a single, go live moment where everything just changes overnight. So again, like it's not about replacing every workflow day one. It's really about having a technology partner that can work with you, that can support your environment in a flexible way that will help you adopt to this timeline without disrupting your operational efficiency and your operational processes.
Oh, perfect, perfect. And so you probably already have answered a little bit of this next question, but how should a provider organization prepare over the next 6, 12, or even 18 months?
I think the important place to start is to understand where you are today, right? And not just in terms of technology, but just understanding your current prior auth process and what are your biggest bottlenecks in the process. Is it really determining if a prior auth is required? Is it really the documentation part that's the bottleneck? Or is it really the follow-up with the payers that's taking the most time for your organization, right? So wherever you are, it's really important to understand what is that bottleneck in my prior auth process today. I think at the same time, in the next 3 to 6 months, understand what these rules and regulations mean to your organization, right? And start looking at it from a lens of where is the biggest opportunity? How are these capabilities going to fit into your operation, right? This would be a good time to start thinking about workflow changes, staff training, and then again, how are we going to work in this hybrid environment where some payers are going to support the new standards, some payers are going to continue using the old standards. And I would say in the following 6 to 12 months, as adoption grows, think about operationalizing these capabilities where they make sense, right? Look for opportunities where you can simplify the workflow and reduce the unnecessary manual work, the unnecessary follow-up, right? Because the payer may already be sending you the response in a more synchronous fashion, right? Where you don't have to have your staff spending time to do the follow-up work. So I think at the end of the day, it's not a single implementation project with a go live date. It's a roadmap, like I said earlier, right? So start with where your pain points are, look at the capabilities, and then kind of map them back to where your pain points are and try to, use this as an opportunity to look yourself up in the mirror and then reflect on where it is and, plug those gaps.
Yeah, awesome. It always starts with a plan, not relying on someone else. Make sure that, because your organization, there's accountability, not only on the vendor side, but the provider side and even the payer side. So making sure everything aligns. Sometimes it can be very difficult. So I think your plan lays it out very practically. And so I think that's sound advice for people to take when they're looking at this and making those plans. And it's never too early to start. Maybe never too late to start either. But so now the next question is, tell us a little bit how Infinix is approaching this, with CMS-57 and HTI-4 readiness.
Yeah, so I think from the next perspective, we're really approaching this from the perspective of our customers, right? Like I mentioned earlier, this isn't a technology initiative for us. It's really an operational transition. And that thinking has really shaped up our approach. So firstly, we are investing in building support for CMS-57 and interoperability standards such as PAS, DPR, and CRD. And our roadmap is very much aligned with the industry's implementation timelines. The second thing I would highlight is we're not really treating CMS-57 as a new product or a new workflow. We are extending our prior authorization capabilities and platform that we've already built, right? Customers have invested in our payer connectivity, in our workflow automation, in our intelligence, in determination capabilities, and operational workflows. So our goal is to really extend or evolve those capabilities rather than asking customers to start over. We're already leaders in this space, and we want to, invest and extend that. The third and the most important thing is we are really designing for what we believe will be the reality of the market, which is the hybrid environment. Some payers will support the new standards earlier than the others, and same goes with some of the EHRs as well. So our role will be for customers to navigate this transition with ease, using the best connectivity and the best partner while we're maintaining that operational experience that's consistent for the customer's staff. So I think, ultimately success is not going to be measured by like a checkbox saying, yeah, you did this and you did not implement CMS-57, but rather it's going to be measuring the outcomes of the providers, right? Are they able to reduce the administrative burden? Are they able to, reduce the delays? And are they able to continue delivering care without disruption? So that's really the outcome that's important for providers. And then that's really where our focus is also with this.
That's all the questions I have. I'm going to turn it over to some Q&A. We do have a question from the audience. It's from Crystal, and she basically says, I work in a psychiatric facility. Is this going to require more in-depth documentation for continued stays? For example, PTs that just need medications, not ECT, but need slow but steady med adjustments.
So when it comes to documentation, really, that's the module called Documentation Templates and Requirements, DTR, that's going to help streamline all of the documentation requirements for prior auth. I mean, if you really think about from a workflow perspective, you initially get a request for determination that tells you yes or no, that a determination is needed. And along with that, it is also supposed to tell you the documentation requirements for your prior authorization, right? So that particular step is going to help the providers think about what documentation do I need to be submitting even before this request goes to the payer. So that guidance will be provided from the payers itself for you to be well prepared of and thinking about what needs to go for a successful outcome, right? Be it an approval or a denial, but an outcome. So I think that's the key part when it comes to documentation, is that they will make this available to you in the sense of requirements. And then the part that we would need to do as providers is make sure we gather the documentation to the best of our abilities and submit it.
Yep. I would agree as well. This regulation is not necessarily about individual policies that payers or plans may have. And so this is really just making sure that that information is going to be processed and sent back and forth in a more efficient way. So couldn't agree more. So I hope that answers your question, Crystal. So another question we have here, we think we have time for a few more. For smaller provider organizations that may not have a large enterprise EHR, which we know EHRs are going to be all over this, or a big internal IT team, what are the first questions they should be asking about this new regulation and the readiness for it?
Honestly, I don't think smaller organizations should feel like they're left behind or that they're at a disadvantage for some reason, right? A biggest misconception is that you need a large IT team to prepare for a regulatory change. I think in reality, it's again, an operational conversation rather than a technology conversation, right? As I pointed out earlier, it's really about understanding where prior authorization slows you down today, and then understanding the biggest pain points from that perspective. And the second, the more important thing I feel like is you don't have to really rely on your internal capabilities to solve the problem yourself. Find a good partner, right? Find a good partner and an authorization vendor that has already solved this problem or is solving this problem, thinking about all the things that we talked about earlier, being, do they have flexibility? Can they keep in mind your existing workflows? Are they going to break your current workflow, right? So find a good partner that you're going to work with and be comfortable navigating this journey. Because again, it's not going to be a change in day one. It's really going to be a journey, and find somebody that you can travel along and make it comfortable for you.
Excellent. So I'm going to try and squeeze one more in, Arthi. So, what should providers do during the transition period if some payers are ready for more electronic prior authorization workflows, but others are still relying on portals, fax, phone calls, or manual processes?
Yeah. I think providers should plan for exactly that scenario, because I think that's going to be the reality, right? So my advice is don't build separate operations or separate workflows for different payers. Your staff shouldn't really have to remember, for Aetna, I'm going to use this portal, and for this particular payer, I'm going to use Fire APIs, and for this other payer, I'm going to fax documents, right? I think that just creates complexity in the process. Instead, your goal should be to maintain a consistent prior authorization workflow for your team. And again, move the burden to your technology partner to handle all those differences in how information goes out, right? Because your technology partner for all you know is already built to handle that, right? The flexibility. And as more payers adopt to CMS 57 capabilities, you should be absolutely taking advantage of them, but don't take it all on yourself. Find somebody that has already built this in a way that your operations can plug in easily into their workflow without changing all of the processes for you and your staff overnight.
Awesome. Awesome. Well, I think that's all the time we have, but we could go on and on. But just thank you for your time, Arthi. Thank you for coming on and joining us today. I hope you had a good time, especially bringing clarity to this big event that's going to be happening.
Yeah, no, this was a very good conversation. I love the questions. And I think, like I said earlier, this is going to be a journey, right? So there's a lot more to come. We'll see Jan 1 how, the reality is. But yeah, this was a great conversation. Thank you for the opportunity, Stuart.
Oh, no worries, no worries. Yeah, we will see January 1. All right, so awesome. And I want to thank everyone else for joining us, whether you're live or you're watching it on demand. Thank you for doing that as well. But you can also visit us at Infinix.com for more articles, case studies, and insights on all things revenue cycle.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at Infinix.com. That's INFINX.com.